Hey guys, welcome back to the channel. In today's video, I really want to touch on a very important topic, and that is knowing your risk factors for heart disease, also called cardiovascular disease. February is American Heart Month, so I really want to touch on this topic because it is very important, okay? There are multiple risk factors to getting heart disease, and I'm going to go through some of those. But I think just being aware of the statistics that the Centers for Disease Control and Prevention puts out there regarding how many people are impacted by heart disease is really important. And it's also pretty shocking, to be quite honest. So according to the Centers for Disease Control and Prevention, every 33 seconds, one person in the US dies from a heart-related disease. And that is a pretty staggering statistic, okay? And the thing is, it is something that can be prevented. It absolutely can be prevented. So if you asked yourself, or maybe you even know of friends or colleagues, even family members that have had a heart attack or a stroke, it is something that can absolutely be prevented. So some of the risk factors for cardiovascular disease include hypertension, also called high blood pressure, and high cholesterol, diabetes, if you're definitely consuming a excessive high amount of alcohol, do you smoke? And then you also add in physical inactivity, obesity. These are risk factors that are severely going to put you at risk for getting cardiovascular disease. And like I mentioned, these are things that can be prevented because these are lifestyle modifications and things that you can change. Of course, change is not overnight. Change, in my opinion, starts off with really small, tiny steps that will add up to be bigger things, okay? So when it comes to making lifestyle changes, it doesn't happen overnight because certain behaviors that you have been implementing you didn't just start doing them overnight as well. So just being really cognizant of that and being patient with yourself to start making one little change a day that will help to improve your health, your lifestyle. That's the key. One little change a day. So one of the first things that you can do to decrease your risk of getting cardiovascular health is obviously being aware of the types of foods that you're nourishing your body with, making sure that majority of your meals are not highly processed foods loaded with a lot of sugar, salt content. So just being aware of what are you nourishing your body with. The other key thing to keep in mind is some form of physical activity. Physical activity does not mean you need to now go and live in the gym. That's not what it means. You can start off with simple things like walking around your neighborhood. Start off with just like a 1 mile walk a day, a 15 to 30 minute walk a day. Start off there and see how your body is handling that. Definitely also make sure that you're checking in with your primary care provider, whether that's a physician or a nurse practitioner. You want to be checking in with your primary care provider to get screened, to get your blood work done. You need to know, what does your cholesterol levels look like? What is your triglycerides level looking like? You need to know all of these things. Get screened for diabetes. Get your A1C checked, okay? So just being mindful and proactive of getting screened to make sure that you are aware if there is something going on so that you can take action. I always say that ignorance is not bliss, and just because you have not been screened to see if you have these risk factors doesn't mean that you don't have it, all right? So if you found this video to be helpful for you, definitely set up an appointment with your primary care physician and go get screened. Go find out if you have any of these risk factors for cardiovascular disease. And drop a comment below if you found this video to be helpful for you. I would love to hear your feedback. Hope you guys have a good rest of the day.